Hello, and thank you for choosing Glens Falls Hospital for your upcoming total joint replacement surgery. We hope you have an excellent experience and we wish you a speedy recovery. The information that's going to be discussed during this presentation is specific for patients who are going to have a total shoulder replacement. If you have received your journey guide for your total shoulder replacement, please grab that now along with a pen in case you would like to write anything down. We're going to discuss everything from the time that your surgeon makes your decision for surgery throughout your entire recovery. You don't have to memorize everything that's in this book, but we do suggest that you keep it handy as a reference as you prepare for this undertaking. I would like to introduce you to the dedicated professionals who will be by your side throughout your total joint replacement journey. Myself, Nicole, and my colleague Sam are your orthopedic nurse navigators, and we serve as your primary points of contact before, during, and after your surgery. With many years of experience in orthopedic care, we're here to address any questions or concerns that you might have. We want to make sure you feel informed and confident every step of the way. We will reach out to you approximately 4 to 6 weeks prior to your surgery to gather essential information and provide personalized preparation guidance. As a consistent presence, we collaborate closely with your entire total joint team, including your orthopedic surgeons, physical therapists, occupational therapists, and care managers to tailor the best treatment plan and discharge care possible. If you need any assistance or if you have any questions, don't hesitate to reach out. Sam and I are available Monday through Friday from 8 a.m. to 4:30 p.m., ready to support you in any way we can.
Hi, my name is Grace. I'm one of the PAT clinic nurses that you'll meet when you come in for your appointment. Our office is located on the third floor of the Prime Pavilion. So when you come in through the Prime entrance at the hospital, you're going to turn to the left until you see the elevators, bring them up to the third floor, and as soon as the elevator doors open up, you're going to see this glass door that says Welcome to PAT. These appointments can last anywhere from 45 minutes to an hour. You'll be seen by both a nurse and by a PA that works for anesthesia. Some of the things that we go over with you are allergies, medication, food, and metal allergies, especially pertaining to nickel allergies. So if you know that you cannot tolerate cheap jewelry, watches, or rings that cause your skin to break out, let us know. There is a chance that your prosthetic joint may have nickel in it, and we definitely do not want to put that in your body if you know that you have a reaction to it. We also go through your medical and surgical history, family history, especially pertaining to problems with anesthesia or a condition called malignant hypothermia. We want you to bring a medication list with you to this appointment. On page 5 in your book, there is a graph that you can use to fill in for your medications, or if you already have them wrote out on a sheet of paper, you can bring that. This is prescription medications and over-the-counter medications such as vitamins, supplements, because some of those medications and supplements will have to be held prior to surgery, and only certain ones will be taken day of. We go over the doctors that you see, especially if you see a heart doctor or lung doctors. We'll do any pre-op lab work that you need, for example, blood work, swabs, or an EKG if you do not see cardiology. And we also go over all of the instructions on when to take medications, when to stop medications, and other preoperative instructions. For those of you who want to use it, we do have a pharmacy here at the hospital that you can use to pick up your medications on your way out. While you're in recovery, your joint coach can pick that up for you, or you can pick it up on the way out the door. For those of you who are diabetic, you know that keeping your blood sugar under control is extremely important, especially when you have an upcoming total joint replacement. Our surgeons have a cutoff of an A1C of 7.5. So if you know that your A1C is more than that, let somebody know ahead of time. That way we can recheck your A1C prior to your PAT appointment. If you do not know what your A1C is, we will check it when you're coming in for your appointment if it has not been checked in the last 90 days. Preparing for surgery. We do not want anyone to have any nail polish, artificial nails, or gel or acrylic nails on either of your hands. We do not want you shaving under your arms for the last 7 to 10 days prior to surgery. And when you come into the PAT appointment, we're going to give you 2 bottles of soap. The first is benzoyl peroxide, which you will use on your surgical side, your upper chest, shoulder, arm, and underarm. You leave them on for 3 minutes and then rinse that off. And then you'll use the second bottle of soap, the HIPAA Cleanse, over your entire body except face and private area, and you leave that on for 3 minutes before rinsing that off. You're going to do that for 3 showers total, the 2 days before surgery and the morning of surgery. You're not going to be allowed to eat or drink anything after midnight. This includes gum, mints, and candies. And if you smoke cigarettes, no smoking for 24 hours prior. If you use marijuana, CBD products, or drink alcohol, none of that for 48 hours prior. If at any point between you receiving this video and your day of surgery, you develop fever, cough, sore throat, body aches, migraines, anything that's out of the usual for you, any dental issues or infections, cuts, sores, rashes, bumps, bruises, please contact either your orthopedic nurse navigators, let us know in the PAT clinic, or contact your surgeon. These kind of issues can cause a delay in your surgery. The big question a lot of people have is, what time is my surgery? If you are a Tuesday through Friday surgery, you're going to call the day prior to your surgery. If you are a Monday surgery, you're going to call the Friday before to this 1-800 number that's on your screen between the hours of 2 and 3 in the afternoon. They will tell you what time you need to be here and what entrance that you're going to come through. And just know that your arrival time is approximately 2 hours prior to your surgery time, but we do need you to understand that you do need to be on time. There's a lot of information and a lot of things that have to happen before you can go into the operating room, so please be on time. And just know that the earliest arrival time is 5:30 in the morning. If you're told to be here for 5:30, that means that you're going to be in the operating room anywhere between 7 and 7:30. Morning of surgery, after you take your last shower with the benzoyl peroxide and the HIPAA Cleanse, nothing goes on your skin. No lotions, no deodorant, no makeup, perfume, cologne, no hair products, no metal. So all jewelry and piercings must come off. Nothing at all on your skin. And then for those of you who have sleep apnea and you use a CPAP or BiPAP, please bring the machine with you on the day of surgery. There is a good chance that we will be using your machines while you're in the recovery room.
Hi, my name is Carolyn and I'm an RN that works in the recovery room. The next several slides, I'm going to discuss what will happen from the time you arrive at Glens Falls Hospital to the time you are discharged. On the morning of surgery, we would like you to arrive at the tower entrance, as you can see in the picture. Valet services are available from 6:45 in the morning till 4 in the afternoon at this entrance. And this is not something you have to do, but if you would like that service, it is available. Also, I'd like to point out that if you need any assistance getting in, if you need a wheelchair or just an extra set of hands, please come in and ask for that, and that can be arranged. Once you come in, you're going to be greeted by the security desk, and you'll have your picture taken there, your visitors will. Then you're going to take a right and go down the long hallway to the registration desk in the west lobby, where they will ask a brief amount of questions there. Once you're done at the registration desk, if you need assistance in getting upstairs, somebody can escort you, or you can find your way up to 4 Central. It's kind of in the middle of the hallway. It's called AM Admissions. You'll be directed by that staff member to go to your pre-op admission room, and the visitor that's with you, typically called your joint coach, will be asked to wait in the family waiting room. It's down the end of the hallway, just for about 30 minutes so we can get some things started. And then your joint coach will rejoin you before you head off to surgery. Once you're settled in your AM admissions room, the RN will start getting you ready for surgery. This is where you're going to change into a hospital gown. They'll do a set of vital signs. This is the room an IV will be started. And if needed, any labs would be drawn at this time. There's always a chance that if you need a chest x-ray or an EKG, anything like that, that would be done in this room. The admission RN will be asking you a lot of questions, some of which have already been reviewed. Also, you will meet your anesthesia provider, and they're going to be reviewing a lot of the same questions. A lot of this is going to be repetitive, and it's just all safety for you and that we're all on the same page. Your surgical site will be scrubbed, and if any hair needs to be clipped, they have special clippers that will be done at that time. The surgeon will also be joining you in that room. They use a special marking pen, confirm that it's the right surgical site, and put their initials on your skin. You will be joined also by staff from the operating room, so you'll meet a couple of RNs from there. And at this time, usually we ask that glasses, hearing aids, dentures, etc. be removed, and you can send them with your joint coach, family member, who's ever with you. If you want to keep them with you, that is also a possibility. You just need to let somebody know. We keep them in a green bag that has your identification on it, and when you're awake enough and safely can have it back into recovery room, we can give it back to you. Also, a lot of people these days want their cell phones with them, and that's fine also. We just have you put it on mute, and you can keep that with you. So this slide just briefly discuss what's called a peripheral nerve block. This is something that you may or may not have done. Your anesthesiologist will discuss this with you the day of surgery. A lot of times they are done preoperatively, but they also can be done after surgery. Nurses who are specially trained will assist the anesthesiologist, and basically what they're doing is injecting numbing medicine around the nerve where you're going to have the surgery, and they use an ultrasound guidance approach. This will help decrease pain, so you'll be using less narcotics, less pain medicine, and hopefully decrease nausea and vomiting after surgery. And typically this does last 12 to 24 hours. Once you're in the operating room, you're going to notice that the setting in there is very cold. Some of you probably have experienced that from surgery before. We have warm blankets, some that blow warm air, some that we keep in heaters that they always put right on you. You're going to be meeting everybody that's part of your surgical team. Once again, they're going to ask a lot of the same questions. Ask you your name, your date of birth, and the procedure you're having done, whether it's left or right, and who your surgeon is for the day. You're going to be moving over from your stretcher onto the operating room table. This is also a good time to remind people if you're currently experiencing pain, or you have difficulty or limited range of motion, or pain maybe in another joint or another area, they can assist you in moving over from the stretcher to the table. You'll probably be awake when they start putting some of the monitoring equipment on, and then anesthesia will get going on their part. After the operating room, you will arrive in recovery room. This is an all RN staff, so the registered nurse will be at your side. When you wake up, you will have an oxygen mask over your face, sometimes a nasal cannula. If you can remember ahead of time, if you're very claustrophobic, that's always a good thing to discuss with anesthesia, so we can try to switch the mask off as quickly as possible and get you to the nasal cannula. The nasal cannula is like the picture on the left, just the little prongs that go in your nose. A lot of what goes on in recovery room is where we're going to be managing your pain and your nausea. On the side you can see it says anticipated PACU time is a minimum of an hour. So it varies greatly how long you will be in recovery room. Everybody gets the safe amount of recovery time that they need. Everybody's situation will be a little bit different. Most patients go home after this, so it really just depends on how quick they're waking up and how everything is going. They will be seeing therapy while they're in recovery room.
Hi everyone, my name is Taylor and I'm an occupational therapist here at Glens Falls Hospital. After your shoulder replacement surgery, you may work with an occupational therapist before you are discharged home. Occupational therapy focuses on your daily roles and responsibilities, including what are called your activities of daily living, or ADLs, which include dressing, bathing, and toileting. Your OT treatment before discharge home will focus on completing your ADLs without assistance, including dressing yourself, applying and removing your sling, and bathroom mobility. We will also provide a simple exercise program for you to perform while recovering and educate you regarding your precautions after shoulder replacement surgery. Occupational therapy also addresses what are called your instrumental activities of daily living, or IADLs, which include tasks like cleaning, laundry, meal prep, driving, and working. While you are recovering from shoulder replacement surgery, IADL tasks are better managed by what will be called your joint coach or your main support system after surgery. So your joint coach will be your primary support person at home. It can be a spouse, a family member, a friend, a neighbor. They should be staying with you for about 1 to 3 days or longer after discharge from the hospital and provide 24-hour supervision. They should also attend your first therapy appointment with you for support and education. And just as a friendly reminder, you will not be permitted to drive until you're cleared by your surgeon. You should arrange transportation from your joint coach until at least your follow-up appointment, which will be 10 to 14 days after your surgery. After your shoulder replacement, there will be precautions for you to follow in order to protect your new shoulder. They are as follows. Keep your arm in your sling with or without the bolster pillow at all times, except for bathing, dressing, and completing approved exercise program. Your sling should be worn when you're sleeping as well. Do not put any weight through your surgical arm. There's no pushing, lifting, pulling, or carrying items with this arm. You also cannot lean on the arm, like leaning forward on your armrest or on your knees. Do not reach for objects with your operative arm. Avoid any active range of motion using your operative shoulder. This means do not move your shoulder or shoulder muscles on your own. You'll receive guidance from your therapist and or your surgeon regarding when you'll be able to actively move the shoulder. No reaching behind your back. This is especially important during tasks like pulling your pants up or completing hygiene after using the bathroom. And lastly, avoid moving your elbow back beyond your waist. This is called shoulder hyperextension. You should be able to see your elbow at all times in your peripheral vision. When sitting or lying down, place a pillow or rolled blanket under the elbow to keep it in your field of view. And we're going to show you how to put on a shirt after you've had your shoulder replacement surgery. For our purposes, Wayne is standing, but if you needed to, you could complete this activity in sitting on a chair or at the edge of the bed. So the first thing that you're going to do, your left arm is just kind of hanging there. You're going to take the shirt with your right arm and thread your left arm through your sleeve. Good. So you're going to pull the shirt up, being extra careful not to move any shoulder muscles. And then we're going to kind of pull the shirt back around to get your other arm through. So this would be where your joint coach may have to step in and assist you a little bit with negotiating getting the shirt around your body. Now, once you've got the shirt situated, you can leave it either unbuttoned. If you did want to button it, you would leave that arm hanging and try to complete the buttons with one hand. All right, we're also going to show you how to take your shirt off since we showed you how to put it on. So the first step would be to unbutton the couple buttons that you did with your good arm. And next, we're going to take your good arm out of the sleeve. So you might need a little bit of help back here to get it the rest of the way off of the arm. Now you'll take your non-surgical arm and you're just going to pull the sleeve down off of your operative side. Make sure you're not moving your shoulder and the arm is just very passively hanging there. You're not actively moving it. You will have a waterproof dressing covering your surgical incision. The dressing should remain intact until your follow-up appointment with your surgeon. As long as the dressing is intact, which means no peeling or edges pulling up, you're able to shower. While you are showering, it is important to keep your operative arm resting on your lap and still. Do not reach for objects in the shower using your operative arm. In order to wash under your arm, you may bend at the waist and allow the arm to passively swing forward away from your body. Make sure that you completely dry the skin under your arm after you're done showering to protect the skin and prevent breakdown. Properly wearing your sling after surgery is important for recovery. Again, you must have the sling on at all times except for bathing, dressing, and completing your exercise program initially after your surgery. So this is your sling to be worn after surgery. It's composed of two parts, the immobilizer, the bolster pillow. The bolster pillow is at surgeon discretion, so not every single person will have one. But if you do, we are going to show you how to put that and the sling on. First step is to get the bolster kind of positioned under the elbow, right along the rib cage. Then we're going to open up the sling, get the arm positioned in there. Crook of the elbow goes towards the back of the sling. We're going to Velcro so the arm does not fall back out. And then you have two mechanisms for closing the sling and holding it in place on your body. The first being the neck strap, which comes down around the opposite side of your neck through the two plastic loops and Velcros like this. We want to make sure that your arm is level in the sling and high. We don't want your arm sinking down or crooked in the sling. The last mechanism is this abdominal belt. Goes right around your belly and fastens in the back of the sling. This helps keep the bolster and the sling all attached and in the same place. All right, now that we've shown you how to put the sling on, we're going to show you how to take it back off again. And just a reminder, the sling is only coming off when you're getting dressed, when you're taking a shower, and when you're doing the pre-approved exercise program. Other than that, we're staying in the sling. So the first piece to taking the sling off would be to unclip the abdominal belt. Next, we're going to unclip the neck strap. And then with some support from your joint coach, you're going to just kind of slide the sling and the bolster pillow out from under the arm, being sure to support that arm so it doesn't fall to the side. As previously mentioned, there are a few exercises post-operatively that you're able to perform. These exercises are designed to prevent stiffness in other joints like your neck, elbow, wrist, and hand while your shoulder is recovering, and to keep those other joints functioning. We recommend performing one set of 10 exercises twice a day to your tolerance. Exercises should be performed within a comfortable range of motion. We cannot guarantee that there will be no pain with the exercises. We also do not want you performing exercises such that they produce 8 to 9 out of 10 pain in your arm. These basic exercises are your initial exercise program. After your nerve block has worn off completely, typically 2 to 3 days after surgery. All right, your first exercise is just moving your fingers and opening and closing your hand to keep your hand from swelling and keep your finger joints functional while your shoulder is recovering. Make sure to do this slowly, and you're going to do one set of 10 twice a day. Your next exercise is going to be to drop your wrist down, so you might need to move your arm a little bit more forward. Perfect, and bring it up. Good. Make sure that you're controlling the wrist. You're not just letting it flop down, and you're pulling it up as high as it'll go. Try not to use your shoulder to compensate. Perfect. Next exercise will be to turn your palm up towards the ceiling and then back down towards the floor. It's important with this exercise that you turn your palm as far up or down as it'll possibly go within a comfortable range of motion. Perfect. Next, you'll want to keep your palm up, and you're going to try to bend your elbow to touch your shoulder. When coming down, try to straighten that arm out as much as you can. And again, notice how still his shoulder is and that he's not moving any of his shoulder muscles while he's completing these exercises. If you couldn't do this by yourself, your joint coach could help you bend that elbow and straighten it back down. A solution if you were by yourself would be that you would use your right arm to assist the left arm through the range of motion. Our last set of exercises are for your neck, to keep your neck from getting stiff since you'll be wearing a sling for a majority of the time. The first one is to just try to tuck your chin to your chest. Good, and now bring your neck back as far as you can and look up at the ceiling. Make sure you're doing this slowly and controlling the movement. Good, and if you have limited neck range of motion, just go within the range of motion that you have available. Next, you're going to turn your head from side to side. The last exercise is a side bend. You're going to try to touch your ear to your shoulder. And notice how Wayne does not try to bring his shoulder up to meet his ear with this exercise. That's not what we want. And this is your exercise program for the first 14 days after your surgery. Outpatient therapy is prescribed 2 to 3 times a week, starting after your first follow-up appointment, which is 10 to 14 days after your surgery. After the 10 to 14 days, your surgeon will clear you to begin additional exercises to your operated shoulder. A therapist will instruct you on what these exercises are and how to perform them to ensure that they're being completed safely and correctly. Bringing your joint coach to your therapy evaluation is recommended, as some exercises require the assistance of another person in order to safely complete them. We strongly urge you to pre-book your outpatient therapy appointment after you have scheduled your surgery. The benefits of booking ahead of time are listed on the slide, but include being able to choose a convenient time and day, having a consistent care team, and reduced risk of having a gap in your therapy regime. The therapy provider for outpatient therapy is your choice. While discussing items to complete before your surgery, there are some pieces of equipment that we recommend you obtain in order to be prepared for completing self-care tasks after surgery when you've returned home. A handheld shower head is recommended for convenience to be able to use the wand with your non-operative arm in order to wash your hair and body. Some patients may benefit from a single point cane to assist with mobility after the surgery, as your center of gravity shifts when you have an arm immobilized, which can in turn affect your balance and safety with walking. A 3-in-1 commode is also beneficial for increased height over the toilet and arm support to assist with transferring onto and off of the toilet. The commode can also be placed at the bedside. It does come with a bucket underneath it for use during the night to avoid having to get up and walk to the bathroom. We also recommend some type of seat for showering. If you have a tub shower, we recommend the tub transfer bench. The tub transfer bench bridges the gap between the inside and outside of the tub to avoid having to step into and out of the shower. Instead, you sit down on the end of the bench and swing your legs into and out of the tub to get in and out. The rationale of sitting to shower is that showering is a high-level balance activity when you think about all components involved. As you will not be able to use your surgical arm to right yourself if you lose your balance, you are at increased risk of falling and or injuring your new shoulder if you were to attempt to shower without a surface to sit on. For traditional shower stalls or walk-in showers, a simple shower chair will be sufficient. Locations where you can obtain the recommended equipment are listed on this slide. Another resource for some of the equipment that other patients have found success with was using websites such as Amazon. Keep in mind that if you order the equipment off of Amazon, you will own the equipment and have the option to use it for future surgical procedures if needed. Please have the equipment in place in your home about 1 or 2 weeks before your surgery date. Lastly, I want to talk about preparing your home before surgery. It is important to set up your environment to keep you safe and mobile after your surgery. Remove any unsecured throw rugs for the time being to reduce risk of falling. Keep your walkways clear and during the night hours well lit to allow you to safely get around the home. Put your most used items in shoulder to knee height areas, meaning items like plates, pots, cups, laundry, detergent, pet care items, and even canned foods. This prevents you from having to shift your weight to reach into a high cabinet or bending down to obtain an object from a low cabinet. Your joint coach should be able to assist with any chores that would involve the use of your surgical arm, including sweeping, mopping, and vacuuming. We hope that you find this video and PowerPoint presentation helpful in preparing for your shoulder replacement surgery and wish you the best of luck with your new shoulder. Please refer to your joint book for further information.